question reads, Mrs. Tembo, aged 20 years, has been admitted to the I ward with a penetrating eye injury following a domestic dispute with her boyfriend. The first question, to draw a well-labeled diagram of the eye. So when it comes to drawing, you first thing first, you need to, the title, it matters. So you even make a title, the drawing of an eye, or an eye diagram as a title. You even underline it. It's a mark on its own. Then you label the parts which are there. You just label the parts. All the parts, just label it. Just make up to 15. All the parts: cornea, iris, sclera, retina, ciliary bodies, anterior and posterior. All those labels, just label them up to 15. I think that one you won't have issue with it. Then the next one, you go to question B. So draw a well-labeled, you make sure you come up with 15 titles just after labeling. It's not even hard. I'll draw for you, then I'll do like what I've done, then I'll pause it. Then the question B, outline 5 complications that may occur due to penetrating eye injury. An eye injury, this is a situation where somebody happened to someone happened to maybe stab someone in an eye just. So the complication there, one, they can have just any question which he asks you to outline. You just need to outline. Any question which asks you to state, you need to give a bit of explanation. But state and mention, you have to give a bit of explanation concerning that. But outline and list, just mention. So here we can have conjunctiva tear, which is conjunctiva, which is the tearing of the membrane which is covering the eyeball. But you are not supposed to explain. Just conjunctiva tear, cornea tear, and cornea scarring. Also, you can have what we call eye detachment. Then we can have hypopion. Yes, there is this a situation where you can have hypopion. So they just wanted 5: conjunctiva tear, cornea tear, cornea scarring, hypopion, where they can be upside down, the eyelid. That's all about that question. It's not even hard. Now the question C, it's saying outline the pre-op care you would give to Mrs. Tembo. Pre-op care. This is elective surgery. We are not supposed to go, yesterday we looked at the aims and everything for elective surgery. So yesterday we looked at the aims. After having looked at the aims, having looked at elective surgery, you start with the aims of pre-op. Aims of pre-op. From there, you go to patient's admission stroke environment. What are you going to say under patient's admission stroke environment? You say all those things. You explain. You say all those things. Patient admission, then you go to psychological care. Psychological care, preoperative teaching. Preoperative teaching, consent signing. Consent signing. Then you follow all those things. Then I think you are not supposed. It's not even hard. You go to nutrition investigation, nutrition, physical preparation, which is GBB, leukocyte and skin preparation. In this case here, this patient need to bath. Someone can bath here because this is not an emergency. Then from there you go to other things. Then the next question reads as follows. If you have got any question concerning this, it's fine. You can ask me, I'll answer you. The next question says, explain any 5 forms. Explain any 5 forms of gender-based violence. Explain any 5 forms of gender-based violence. I'm sure you covered this. If you haven't covered, which means they cannot bring it, but if you covered, they can bring it straightforward. It will be there. So we can have these 5 types of gender based violence. I think that we have covered. Maybe you have covered, or I need to come up with a topic, then I can just list the gender-based violence. Gender-based violence refers to harmful act acted by definition, refers to harmful act directed to at an individual or group of individuals based on their gender. It can be violence against women and girls, survival violence, domestic violence, femicide, sexual violence, human trafficking, sexual violence, human trafficking. You can have a lot of these. If you've got any question, you can ask Sioma, you will answer you. We were rushing to the question for Benz.